I told you endotracheal tube for children below 6 years doesn't have cuff, but there is one tube which is exclusively manufactured for this, an cuffed tube for children less than 6 years. This is called Kimberley and Clark tube, the two micro cuff, contain the micro cuffs. So below 6 years, if you want to use an endotracheal tube, use the Kimberley and Clark micro cuff tubes which exert very minimal pressure on the tracheal mucosa. Now what will happen if you exert too much pressure on the tracheal mucosa for any patient? Too much of pressure continuously for more than 3 weeks can result in tracheal stricture, because the wound heal by fibrosis and there can be tracheal stricture. And if you are expecting more than 3 weeks of intubation, then always better to do a tracheostomy. Elective tracheostomy is a better option. So that is also another point which you need to remember. Coming to the various varieties of the endotracheal tube. Now various varieties of the endotracheal tube, there are different types, like till now we have seen the normal conventional tube, that is the PVC tube. Now see this is known as RAE tube. RAE tubes are called ring Advin Eldin tube. Don't worry about the name of the tube, just remember the catch area is called, this is called preformed tubes. That means the shape of the tube is preformed. See the peculiar shape of the tube. So you know that depending upon the curvature of the tube, that means the relative position of the machine end and the patient end, you can have either a north pole tube and a south pole tube. Now why should we have this? This is because when you want to do a surgery, the surgeon will always prefer to have the tube away from his surgical field. That is why we have a different type of tubes which point towards the various direction. For example, this is the machine end of the tube where you connect to the breathing circuit, and this is the patient end. So if the machine end faces towards the head end of the patient, then you call it as a north pole tube. Now if the instead of this it is like this, that means the machine end is facing towards the leg end of the patient, then you call it as the south pole tube, south pole RAE tube. This is an example of a south pole RAE tube. You can see the machine end is facing towards the leg end of the patient. Which surgeries do you use this? When you want to do a repair of the lip, upper lip surgeries, palate surgeries, etc., you want the tube to be to the other side. Now if you want to do the surgeries in the lower lip, etc., then you prefer a north pole tube. See, in this north pole tube you can do the surgeries here. So the tube doesn't come into that side, the tube is towards the northern side or towards the cephalic side, and the surgeon can perform the surgery here. So this is the difference between north pole tube and south pole tube.